this is the first time I've actually done a podcast solely directed on our profession because, like me, you're an audiologist. And for those that are not aware, audiologists are clinical doctors of hearing and balance. We have a very broad scope of practice where we cover all kinds of different pathologies, education, consultation, into prevention, of course, assessment. And then when diagnosis is made, we help with rehabilitation after the fact, whether that's related to the ear for hearing or for balance. And that gets really complicated from there. But it's just such a fascinating field that I'm passionate about. But this is the first time I've talked to anybody because, unlike me, you're one of the top audiologists in our field, and you've been doing it a little bit longer than I have. And as we've got to know each other because we have a mutual friend in Gail Whitelaw who introduced us recently because of all the overlap in our lives, not only audiology, but with resilience. I've gotten to know you pretty well in the past few months and some of the cool things that you're doing. But what I don't know is what got you into audiology?
Wow. That's a big question. So first, thank you so much. This is such an awesome opportunity just to have a conversation. You and I have been talking offline so much and you getting to know me, but me getting to know you. And there's a lot of kind of mutual respect that we have for each other, especially for all the things that you've done from a service perspective, not only from an audiology world, because I know you do a lot for our field, but also from a military perspective. So thank you for all that. And all the stuff you're doing is not only inspiring as an audiologist for me, but also as a human being. So you're going to say a lot of junk about me, how I'm respected and all that stuff, but it's right back at you.
Thank you, brother.
So how did I get involved in audiology? It's really not that complicated. I was a musician as a kid. I played bass in a hardcore band as a kid. A lot of noise exposure. Experienced tinnitus ringing in the ears after the show, after rehearsal, and I thought it was just a sign of a great rehearsal, right? And like when you're kids, you think you're invincible and nothing's going to damage you whatsoever. And we'll talk about what that is now in my life going forward as a professional now. So I played bass. I was always interested in music. I was always interested in the media as well. So I went to school, not by choice, to be honest with you. My father, who was an educator in the South Bronx in New York, was very, very focused on me getting to the highest level of education possible because he was the first person in his family to graduate college. So he wanted me to actually do at least that. I had no interest in college whatsoever. I was not a student in high school. I was really focused on music and playing lacrosse, and ended up going to school. He kind of dragged me the scruff of the neck up there. Thank God he did that because ultimately it changed my life being in college for the better. I still continued to play music in college, but I was a communications major. And audiology was not even on my radar at this point, as it is not for most of us when we go into college. But I took an introduction to audiology class. It was part of my major of communications. And I was lucky because I had a professor who was so passionate about what he was doing. And he kind of took me under his wing. He saw that I was a little bit of a troubled kid. Not really troubled emotionally, but like I was kind of not really into the academic thing necessarily. And that was the first semester I ended up getting all A's in my classes because I had an amazing mentor. I found something that was really interesting to me because it combined not only the sound and the acoustic aspects that I was so interested in from a music perspective, but it was also, I was always interested in science too. And that was from my dad. My dad was always like pricking his finger and putting blood on slides so I could look under a microscope when I was a kid. So I was fascinated by that stuff too. So it combined, sound, acoustics, neuro, and all of those really cool things that we know as audiologists, and then the science part of things as well. And from there, I just kind of like, it was off to the races. My dad, just interestingly enough, I told you I barely got into college. My, my dad, when I came back my junior year, it took me till my junior year for the frontal lobes to actually start to function a little bit. So, I brought home my grades and they were all A's. And he literally said to me, "Who are you paying to take your classes?" I said, "No, no, no, I found myself." And he said, "Yeah, sure, do it again." And I ended up graduating from my major with pretty decent grades and getting into a great graduate program. So really it stems from music, which is not unusual for a lot of people in our field. There's a lot of musicians or musically inclined people in our field that just kind of rolled into audiology. I wish I had a really more interesting story than that, but that's pretty much it.
It is interesting because that is a common background because sound, acoustics, and then people lead into it. And another one is now how can I use that interest to help others? And
Sure.
mine was not a music background. Mine was working. I thought I wanted to be a psychiatrist. Well, actually, I thought I wanted to be a sports agent because I like Jerry Maguire. But then I observed a sports agent on the job. I was like, this is nothing like that movie. Switched before I even went to undergrad. But I thought I wanted to be a psychiatrist. Started taking some of the science classes. I'm not into the chemistry stuff. Didn't want to go the MD route. Switched to psychology. Majored in that, but didn't want to graduate early. And from working with children, this was before they were saying on the spectrum, but children diagnosed with autism, Asperger's syndrome, and other different chromosomal disorders or related communication disorders. I decided to pick up speech and hearing science and double major. And then, like you, no intention in undergrad of falling into audiology, but now observing in clinic and seeing some audiologists, including Gail Whitelaw. Um, Really inspired me. Like this just fit. It made sense. So yeah, not planned, and a lot of us do not plan to go into it unless we have some family member with hearing loss or some experience in childhood that shows us what that field is. Because it's kind of a niche field, but it's also a really amazing field where we can specialize in some cool areas, which is exactly what you do. So I'm not bragging about you when I say you're one of our top audiologists because of what you specialize in and how well you represent us as a community with all the public facing things that you've been doing over the years, whether that is talking on these large shows, the stuff that you do with the New York hearing doctors and your practice there, and of course, your more recent company that you founded that we'll talk about quite a bit. I'm curious before we start talking primarily about tinnitus tonight. Kind of what was your career trajectory? Did you have an interest in tinnitus and the STIB, which is kind of what you focus on now? What areas of our field did you work in, and how did you get to where you are now?
I was lucky because my clinical fellowship year was at Columbia Presbyterian Medical Center in New York. So I wanted to go into a hospital setting because I wanted a very broad experience and I wanted to actually be put to the test, especially when you're in a place like Columbia Presbyterian, which is an offshoot of the Columbia University. Some of the top academic people there, some of the top clinicians on the planet, people fly in from all over the world to have surgeries and get taken care of. So I wanted that type of high pressure, high stakes type of an environment. And I started out, I spent about 50% of my time as a pediatric audiologist there and 50% dealing with adults, which I did not want to go into pediatrics, but that was the job that they had at the time. And I took it because I wanted an in. That was the door in. But the beautiful thing about pediatrics is that if you can work with kids, you can pretty much understand and work with anybody. And it provided me with a different lens in terms of how to manage patients and how to deal with some kind of difficult to test populations. That's where I kind of started my work with this STIB as well at the time. Um, Before that, when I was in grad school, I was very, very lucky because I had an opportunity to work with some neuroscientists at the University of Buffalo that were focused on two things that were really interesting to me. One was noise-induced hearing loss. I was a musician, and that just kind of clicked with me. I thought that, going forward, I would want to work with musicians and prevent hearing loss from an occupation standpoint and also from a recreational standpoint. But the tinnitus side of the equation, they were some of the top auditory neuroscientists exploring what was going on with the ear, with the central nervous system in the brain as it relates to tinnitus. And I was exposed to not only some amazing basic research in their labs and even published when I was there, which I don't know how much I contributed, but I got my name on a paper, which was kind of cool. I just collected the data. I was kind of like the lab boy, but it was a great experience. But then also being exposed at the VA, which I know that's something near and dear to you as well. With the VA hospital in Buffalo, my mentor professor, who was kind of top tinnitus neuroscientist on the planet, was doing a collaborative research study with the head of neurology at the VA in Buffalo, where they were literally doing PET scans on the brains of people who can control their tinnitus, which that was the first study that literally proved that tinnitus, which we'll talk a lot about, is a brain phenomenon and it wasn't an ear issue. Completely just blew my mind. They tried to keep me there for PhD, but my then girlfriend, now wife, who's in the next room, said, if you don't come back down to New York, we're done. So I had a really hard decision to make at that point. Actually, it was pretty easy. I came home very quickly. And we're married now for many, many years. So it was obviously a good decision. So Buffalo to Columbia, and then I actually, when I was doing my doctoral work, which we talked about before, I thought I was going to do research for the rest of my life, but then I realized quickly it wasn't really the path that I wanted to go on. I continue with the clinical doctorate at the University of Florida, which was a great choice for me. Um, I ended up working with a lot of musicians, which was great. Preventing hearing loss, doing in-ear monitors, working with how they can actually perform and rehearse safely. I had a wonderful perspective because I was one of them, right? So for me to be able to talk to musicians, it was kind of like talking to peers, but I had a little more information on how to guide them. I left audiology actually for a short period of time, which we can dive into that on a different conversation. But ultimately came back, worked in large ENT practices, and started my own private practice. Now going on about 18 years ago. So this run for me has been, it's really kind of scary to say, but close to 30 years at this point that I've been on this run. And there's never a boring or dull moment. There's always something interesting to learn. And I always surprise myself by thinking just when I think I know something, I know absolutely nothing, which is beautiful about our field and science in general. So that's kind of the cliff notes of it. It's been a great ride so far, and I learn something new every day. That's why I still love what I do.
Yeah, keep that energy going. Once you think you're certain, you know you're on the wrong path. And so we're
True.
always learning, never-ending evolution of science, of possibilities, of just ourselves, even.
Yeah.
Love that. So you've been in the field for 30 years. I'm still in my 30s, about to turn 40, but yeah, you still somehow look younger than me. I feel like everybody I talk to is older and wise than me, but looks younger than me. But so props to you for that as well. Uh, it's it's funny you talk about your fourth year externship and how pivotal it was in your career. Same thing for me. I had some opportunities in grad school, to go to some VAs and other areas that were cool locations that paid more than where I decided to go, which was the Cleveland Clinic. But I went there for a very small amount of money, but for the experience to be in a medical center that had this well-rounded, um, rotation-based externship where every part of our scope of practice, every part of our field, we had an externship in with experts. And it was that time, like I had classes on tinnitus, but as we've talked about before, they had the tinnitus management program there involving all of these different specialties where people would be referred from around the world when they were not having success with audiologists, ENTs, physicians, whoever they were seeing for tinnitus management or for having this bothersome sensation in their ears or head. So they'd get referred, and we had psychologists, physical therapists, neurologists, um, of course, audiologists, ENT, you name it. The specialty that could contribute to the body was involved to evaluate them to see what the contribution was to tinnitus. So I'll ask you, as one of the leading experts of tinnitus, how do you define tinnitus when you're talking to someone who doesn't have a lot of background info on it?
Wow, tinnitus is a big thing, but in its core, tinnitus is a symptom. Um, it's similar to chronic pain in many ways, but tinnitus, in its purest definition, is a phantom auditory perception, um, which means that it does not necessarily have an external sound source. It's the perception of sound, and it's because of some sort of internal body noise. And it could take on many forms. It could take on whistling sound, crickets. Some people describe it as heart beating, which, depending on the type of sound that they might describe, actually helps us from a differential diagnosis perspective as well. But in its purest form is the awareness of sound without an external sound source.
Yeah, a very wise definition that you gave because a lot of people say ringing in the ear. And while that is true, that is a type of tinnitus, there's so many different types of auditory perceptions you may have. And you alluded to the fact that I really like to dig deeper when they talk about what it sounds like, because that can help us kind of tease out or look further into potential sources of that, because so many things can contribute to sound in your head. And obviously, how you perceive that sound and the severity it takes on can really impact your quality of life. You imagine having a sound around you that you don't find too pleasant and it's not going away or it's changing. That can be quite disturbing. And then you start looking up on Dr. Google what it could be. And there's some scary things out there that it actually could be that need to be ruled out when certain things are occurring or not. What do you often tell people when they mention they have tinnitus? Obviously, see an audiologist, see an ENT, so you can get evaluated. But when it comes to a symptom standpoint, where do you like to go for what differentiates kind of common tinnitus that you most likely have from secondary exposure to noise, a little bit of damage, versus something that's worth looking into further?
Well, look, I think as you mentioned, the most important thing is to have a medical evaluation from an ENT, but I would say equally as important is a basic hearing test, right? Because a hearing test can give us a lot of information about what might be the causative factor. As I mentioned, tinnitus is a symptom. It's not a, some people call it tinnitus, which to be honest with you, I prefer not to use that. I think a lot of folks in our field stray away from that because anything that has itis at the end implies there's some sort of inflammation or infection, which is not necessarily the case when it comes to tinnitus. Wish we would have called it something different, but it's been called that for eons, right?
Yeah.
It's actually been described. I think the first, if I, and I could be totally off, but I believe I was looking at something on the history of tinnitus a couple of years ago. The first documented case of tinnitus was in the papyrus scrolls, where they were talking about tinnitus. So it's been with us forever, right? The sad thing, though, is that not many of the there hasn't, at least there hasn't been a perception that there's been a big change in terms of how we treat it. Although there's been a lot that we've been able to do. People still think that there's like supplements or snake oil stuff that you can use, but in any case, but the basic hearing test is critical because that can tell us basically is there something going on with the ear or not, right? For the vast majority of people who have tinnitus, it's purely a symptom of hearing loss. It's a normal thing that occurs. It's just changes that have occurred to the hearing centers of the brain. 100% of people on the planet experience tinnitus. That's just a fact. Now, a very small percentage of people are aware and bothered by it on a regular basis, and we can dive into that. But so that's the first thing is to normalize it for folks and say, look, this is not something that for the vast majority of people that are out there is life threatening in any way. You're not going to die of a brain tumor, et cetera. Now, the only way we know for sure is if we do a scan of the head, but that's a very, very small percentage of the population. Now, if we see that there's something unusual on the hearing test or the individual is presenting with, some other symptoms, it could be numbness in the face or unilateral tinnitus, meaning one-sided and there's hearing loss on one side, those are red flags for us to get further assessment done. It seems like a pulsatile tinnitus, that might imply there's something vascular or blood flow related. So all these little questions that we ask at the outset kind of lead us down a path to help determine, okay, what's the most appropriate next step in how we triage these patients, these individuals. But for the vast majority of people, it's simply a symptom of hearing loss.
I love how you emphasize normalizing it because, like you mentioned, you're a musician. And when you would leave, whether you were playing or we've all probably been to a concert or listened to music a little too loud at times or had exposures to different tools around the house, after the exposure, your ears are ringing. You experience tinnitus, or your ears have whatever other sound that you perceive, but you have sound in your head after a lot of exposure. That is tinnitus. It most likely will not persist. But if you do have some, and with the audiogram, the hearing test, I mean, you can have normal hearing, but still have damage to the hair cells that are in your inner ear that can cause the sensation that is tinnitus. So we see this in the military all the time, where you don't have a significant change in your hearing, but you have this sensation of sound. I mean, it's the number one disability every year through the VA for sure, because noise-induced damage is the number one injury in the military every year. We know the hazard, but it's very hard to completely prevent it with how loud sounds can be from aircraft and weapons fired, but really just in industrialized nations. It's really cool when you look at evidence around the world for more remote areas of the world and you see people in their 80s and 90s who don't have quote unquote presbycusis or hearing loss due to aging because it's not aging that necessarily breaks down the ears. There's wear and tear in the body, but it's wear and tear from exposure from the noises that we hear over time. You described what tinnitus is a little bit, but what kind of analogies do you like to give people to better understand why their ears are ringing or why their ears are making a sound?
Yeah. Well, the one thing that I would say also is that a lot of times there's a couple, and this will kind of lead into why their ears are buzzing or why they're bothered by it also. And this kind of goes back to the studies that were done in Buffalo many years ago, where, prior to those studies, it was assumed that tinnitus was a brain phenomenon, but they weren't 100% sure necessarily. And really, not too long ago, what was happening is if someone had severe tinnitus where it was impacting quality of life, and in some cases, we have these unfortunate cases where individuals are suicidal, right? Because they just can't break away from this cycle of anxiety, stress, depression, tinnitus awareness. Um, uh, and they would literally cut the hearing nerve. They cut the nerve from the ear to the brain,
Make
thinking
it
that
yeah.
thinking that the problem was in the ear. But what would happen is it would just make the symptom worse because now we have completely isolated the brain from any sound whatsoever. And as a result, the brain literally turns up its internal amplifiers searching for sound. And when the brain does that, it creates it's kind of like you might be too young to remember this, but I use this analogy with a lot of my patients who are older, like me. Um, there's a movie called Spinal Tap years ago, which was kind of this fictitious rock band. They had the loudest amplifiers ever, which their amps not only went to 10, but they went to 11, right? So if you turn an amplifier all the way up to full volume with no guitar or microphone attached, that amp is going to make a noise. It's going to hum. That's essentially what your brain is doing. Is when you have some damage to those hair cells or some hearing loss, whether it's subclinical like you're describing or clinical where we can actually measure it. As a result, the brain kind of turns up its amplifiers looking for that sound. And in its simplest form, it's literally creating its own sound. It's parallel to in your world, you have, soldiers coming back from war and they have an unfortunate incident where they step on an IED and they lose a limb. And what they might experience is something called phantom limb syndrome. And it's because the input to the brain from that limb is completely cut off, and the brain creates its own phantom perception. It's just kind of turned up its gain, its amplifiers. It's this exact same phenomenon. It's just a different part of the brain and a different part of the body which has been damaged, in this case, the ear. So that's why we call it a phantom auditory perception. So it's a normal thing that happens when we reduce input to the brain. Everybody experiences that. But the problem that occurs is that for someone who is bothered by their tinnitus, someone who just can't get away from that cycle of awareness, what occurs is that a secondary, at least one other part of the brain gets involved. And again, this goes back to those studies in Buffalo, where not only were the hearing centers of the brain lit up like a Christmas tree when someone was really aware of their tinnitus, but what's called the limbic system, the emotional centers of the brain, are highly activated. It's because we're in fight or flight mode. And the purpose of that part of our brain is to keep us safe. So for some reason, the brain has perceived that tinnitus, that normal, benign amplifier sound, as a threat. And when something is perceived as a threat, we're just constantly paying attention to it because we want to make sure that we're safe. So as a result now, and this is a beautiful concept. Sorry about that.
Ah,
So the brain has this wonderful ability. It's called brain plasticity. You talk about it a ton, I'm sure. You're learning how to actually train your system to become more resilient by exposure, right?
absolutely.
Yeah, there's a physical element, but there's really a brain element. There's a cognitive element there. So the brain is what's called plastic, meaning if we provide the brain with input, it can actually rewire itself. If we deprive the brain of input, it will rewire itself in the other direction. So there's positive brain plasticity and negative brain plasticity. It's just the brain rewiring itself. When it comes to some hearing loss, that's negative brain plasticity. It's just rewiring itself. And that's why we experience tinnitus. But because the brain is plastic, as soon as we get this element of the emotional centers getting involved for some reason, now, for a lot of people, there's a stress related event that occurs: death of a loved one, lost a job, got married, got divorced, had a baby. Something big happened in their life that lights up that limbic system. And then all of a sudden, for some reason, they pay attention to the tinnitus sound. And now all of a sudden, because of that brain plasticity, they start paying attention to it. And then now, because it's a repetitive cycle, the brain is wired just to pay attention to their tinnitus. That's brain plasticity in a way we don't want it to be necessarily. But the beautiful thing is, just as much as we can wire it in one direction, we can actually wire it in the other direction with different experiences and different information. So, long answer. Sorry about that. Clearly, I could talk about tinnitus all day. Um, but at the core of what the reason why tinnitus is there and why it's bothersome is damage to the system, normal rewiring of our auditory system, abnormal perception of it and fear of it, and then there's an abnormal pattern that's evolved because of brain plasticity. That's kind of what tinnitus is in a nutshell.
The Buffalo studies blew my mind in grad
Yeah.
school. I learned about cutting of the nerve and then tinnitus skyrocketing. And just for those that are not aware, our auditory systems are, I mean, I could do an hour brief on just the auditory system alone. I do it quite often, but just to understand, it's much more than this slab of skin on the side of our head. So you go down the ear canal to our eardrum, it vibrates in response to sound, hits our middle ear bones, which hits a window to our inner ear. Our inner ear is encased in, it's bone, encased in bone, filled with fluid. And within that inner ear are hair cells that are organized for the different pitches of sounds that we can hear. That is where damage happens from the majority of the things that cause tinnitus or sounds in the ear. There are other things that cause it, as you alluded to, but 9 times out of 10, 99 times out of 100, it's peripheral damage to that auditory system. When it's working normally, it or abnormally, there's a nerve that connects to that peripheral auditory system that goes to our brainstem and then up to the primary auditory cortex. So the damage is peripheral, but the amplification is central. So no matter what we do out here, particularly if we try to dampen it more, it actually the I had never heard the term internal auditory amplifiers until I listened to one of your podcasts and you talked about. I love that term. That makes so much sense and it helps understand it more. What I've done with the people that I've worked with in tinnitus since grad school going forward is talk about the phantom limb because it makes a lot of intuitive sense to people who are familiar with, yeah, if you lose an arm, you can still feel where your fingers used to be on that arm. The brain has a map of the entire body, and we get afferent and efferent nerve signals, meaning outgoing and incoming nerve signals all the time. As I sit here, my butt in the chair is telling me that I'm sitting in a chair. And if I get out of it, I will feel that. It's continuously feeding in and out. And if you change that cycle, the brain will notice it and it will try to fill in the gap. And that's what happens with the phantom limb. That's what happens with phantom auditory perception when those hair cells are affected in some way. So your answer was long winded, but it explains things so well to help people understand why it is happening in the first place. And if it hasn't gotten to such a point where your brain has rewired to where we have to do a lot of training, habituation, and decreasing the sensitivity that you have to that sound, sometimes just understanding and normalizing, as you mentioned, tinnitus can help people tremendously. I like to use the analogy, we know what our refrigerator sounds like. So you walk through the kitchen, it's running normally. You don't even hear it. That's something your brain tunes out. It's not a threat. If you had never heard your refrigerator, or if it were broken and it sounded different, you would hear that right away. And then you'd be like, what does that sound? Until you solve that, you'd be clued into that big time. So we are threat detectors in every way. And once we understand it, as long as our limbic system has a reorganized to just perceive it as a threat and we have a lot more work to do, we can habituate and take that down quite a bit. So no, I appreciate that answer. That helps quite a bit.
I think the challenge that we also face is that folks like me and you are hyper analytical humans that actually are very dialed into our environment, external and internal. And it's folks like us that are actually the ones who are bothered most by our tinnitus, those hyper analytical type A uh, mathematicians, musicians, folks who are, for lack, and look, I fall into this category, so this is not a negative. It's kind of control. We seek control in our worlds, right? So those are the folks who are most bothered by their tinnitus because we pay attention to this thing as like, oh, this is so weird. What is that? For whatever reason, and then we start to kind of get mentally wrapped into it and try to figure out why. And then that just makes us pay more attention to it. And because again, brain plasticity, we're learning this response. So there's this cognitive element to it, and there's definitely an emotional element to it, right? The stress, anxiety piece plays a major role too. So yeah, it's interesting because there are times, and like I was a musician, I experienced tinnitus when I was playing, but I still experience tinnitus to this day. I'm in my 50s now. I've got a little bit of hearing loss. That's just the way it goes, right? With all the exposures I've had throughout life. But there are times, especially when I'm tired, jet lagged, stressed, whatever it might be, where it's quiet in my room at night. I'm like, oh, wow, there it is. And I find myself just about getting caught. But because I understand tinnitus, I can unravel that thought process, right? But I can see how my patients and the folks who are bothered by tinnitus can just fall down that slippery slope because the hyperanalyticals like us just love to kind of figure our way out of it.
Absolutely. And the parallels of stress management is why it's one of my favorite
Yeah.
parts of the field. You cannot acutely control tinnitus. Over time, you can, like anything, any other habit that you want to reverse, change that you want to make. It's not something that you can do overnight. It's a lifelong endeavor because you're going to get ill, you're going to get sick, you're going to have bad nights of sleep, and it'll come back. But as you learn skills to manage whatever aspect of your character and being, it does get easier over time. It's never completely gone. It's something that becomes a part of you because it is permanent damage. And as you mentioned, at this point in time, there is no snake oil. There is no medication that cures tinnitus across the board. People will promote it. But at this point in time, who knows what happens with stem cells and other things in the future? But it's still a brain phenomenon. So if we can regrow hair cells, there's still going to be an issue in the brain that we have to focus on. And we don't have that good of an understanding of the brain at this point in time. We're not even close to scratching the surface there. So it'll continue to be a very prevalent issue that requires a lot of psychological management, stress management to better first understand and now think about strategies that you can take on. Of course, there are devices that we can use to help stimulate the ear in the areas that have damage. To do what we call mask, or I don't even like to use the term mask because we're not trying to get rid of it. We're trying to decrease its severity. We want you to still hear it. We want to take the edge off a little bit. Just like with pain, I wouldn't want to take my pain completely away, or else once it comes back, I'm going to have to go back to square one. Any symptom that we deal with, the goal is how do we take the edge off so you're functional, and then you can have that positive brain plasticity that you talk about. So with my long-winded talk right there, I'm curious. Before we talk about the very innovative and amazing things that you're doing with the company you co-founded recently in Modern Tinnitus, what have been some of the historical ways that you have helped people manage this bothersome phenomena that is the auditory perception of sound in their ear?
Yeah, look, the most important thing, and unfortunately, look, it is such a huge issue globally. It's about 15% of the global population is bothered by tinnitus and affected by tinnitus. So that's a lot of people that are impacted by tinnitus. The number one most important thing is that we have to help our colleagues in our medical fields not sit there with a tinnitus patient and say there's nothing that they can do. They have to learn to live with it, because if you have a symptom that is keeping you up at night, affecting your quality of life, the last thing you want to hear from somebody is there's nothing you can do. You have to learn to live with it. When there's absolutely nothing further from the truth, then nothing you can do. You have to learn to live with it. So throughout the years, there's, as you mentioned, masking. That was kind of like the oldest thing that we've ever had, is literally taking a sound that's perceived as benign and just flooding the ears or the environment with it, so it covers over tinnitus. For the vast majority of people, that's just a very temporary, it's a band-aid on a compound fracture, basically. It's not a long-term strategy. It doesn't empower patients to be able to, as you said, develop the kind of internal fortitude and resilience that allows them to get beyond their symptom of tinnitus. So, but for some people, they need it, right? They need environmental sound. And I'm not against that necessarily, but it's not like a therapeutic modality that I'm talking about with patients much at all anymore, if at all. Um, Something called tinnitus retraining therapy has been with us for many decades at this point. And it's basically utilizing sound therapy in combination with cognitive behavioral therapy, because we know the two parts of the brain are the hearing parts of the brain and the emotional centers of the brain. And that has been very, very effective in helping patients habituate to their tinnitus, as you said that word before, is, get to a point where it's still in their world, but they don't pay much attention to it whatsoever. And that's our primary goal still, is to help somebody just say, this is not important. It's not something that I need to be fearful of. So they push it into the background of awareness. TRT still forms the foundation of a lot of the things that we do, especially from a counseling perspective and an education perspective. Some people still practice pure TRT. It's a wonderful modality, and it's effective. So I would say that that's one really good option for patients as well. For patients who have hearing loss, milder degrees of tinnitus, just treating the hearing loss with appropriately fit hearing aids is very, very effective as well. Just get sound into the brain and into the ears, help them reduce the communication struggles, the stress associated with that. And oftentimes, patients will do better just by hearing better. It's about 60% of patients, I would say, will see some benefit from just hearing better. Um, we had a technology out of Australia years ago, and I was lucky. I was literally the second person in the United States to be able to use this technology called neuromonics, which basically utilized music, sound therapy. There was it was specifically tailored to each person's tinnitus profile and their hearing loss, and that was effective too. It was a wonderful technology. Um, After a while, I stopped using that technology too because the company kind of lost its way a little bit, and there were other things that kind of popped out, on the line that were a little bit more interesting and more effective, I would say. And then fast forward up to most recent time, 2023, we've been very lucky. We were one of the first clinics in the United States to use a technology called bimodal neuromodulation. Really long word that means we're stimulating two pathways, nerve pathways to the brain to rewire it, to create relief from tinnitus. The company's called Neuromod. I'm not affiliated with them. I don't get paid by them whatsoever. I was just one of the early adopters of the technology. And it's a really interesting technology because what's been found is that if not only if you present sound to the ears, but if you actually present an electrical stimulation to the body in parallel to that sound, it actually will facilitate brain plasticity faster than anything we've ever seen before. And this device was FDA approved. They actually just got approval in Australia and Canada as recently as this week. It's been in development for 17 years. So it's not a new technology per se. It's new to us in the United States, approved in Europe probably about 7 years ago. Wonderful technology. We've seen great results in as little as 6 weeks with a lot of patients who are bothered by tinnitus. So that's unheard of in
Yeah.
terms of that. But oftentimes those are done all in conjunction with some sort of cognitive behavioral therapy, mindfulness-based stress reduction techniques, resilience elements. And I'll just end on this because I think what you said was really, really important before, because most patients, when we go to the doctor, whether it's for, I don't know, anything that ails us, there's usually not a pill that's going to fix that problem, whether it's high cholesterol, high blood pressure, diabetes, which I've been type 1 diabetic for many years at this point. There's no quick fix, but we're looking for that pill to fix things. The only way that we're actually going to get better from all of those things, anything that ails us, including tinnitus, is by building up what you just said is our resilience factor, is being able to develop those strategies, have a better understanding of how we can positively impact ourselves globally, because it's a whole human thing. That's when we actually get to the point of thriving versus suffering, right? So what you said before was so beautiful because it's so important for us to empower patients. And for so many years, tinnitus patients the power has been taken away from them because doctors are telling them there's no pill and they think that's all they can do. But I just outlined so many things throughout the past 40 plus years that have been used for tinnitus that have been effective. So most important thing is just to find the right professional, I think.
Thank you. Yeah, I learned that lesson in undergrad at Ohio State. I had an internship and job in the James Cancer Hospital, so I was working with some physicians and psychologists in pain and palliative medicine. So end of life, terminal care, high um, pain severity, all kinds of other symptoms, and talking with these physicians and psychologists and psychiatrists, they were saying like 9 out of 10, 10 out of 10 on every severity scale you could measure. Their goal was never to get them down to a 0 or a 1, and they wouldn't even want to do that if these patients weren't terminally sick anyway, because that wouldn't truly be helping them. Because if they came out of remission or if any other ailment came back, they wouldn't have the tools to manage things at a lower level. So their goal in any type of management, whether it was the most severe end of life care or somebody just come in with high rates of pain, how can I take them down from a 9 to a 6 or a 7? Significant change for them, but get them to the point of functional so then they can start to manage it themselves, use their own tools, strategies, and resources that we can guide them with, but not solve their problems completely for them because now you have no resilience. When the tinnitus in this case comes back, you're back to 10 out of 10 rather than your brain having that positive plasticity once again. The ability for our bodies and minds to adapt throughout the lifespan just never ceases to amaze me.
Mhm.
And tennis is one of the best ways to demonstrate that. No matter where you are, how bothersome it is, there are ways to improve your perception and your functionality because you and I both have countless stories, I'm sure, about amazing individuals whose lives have perceptually fallen apart because of this phantom sound in their head. And I mean, we can share a few stories if you want to. I've had patients who have thought that sound in their head initially was God telling them that they're a sinner. I had another one tell me that they thought they were implanted by the government and it was feedback from the device in their head. Of course, thinking that they're tumors or cancers or things like that. And as you can imagine, if you had that thought attached to this threat that your brain is perceiving before you even attach feelings to it, there's no way that's not going to be the most prominent thing in your life day in and day out. You are going to, by the sheer will of negative plasticity or unproductive plasticity, make that perception progressively worse and worse and worse. And progression is concerning to us because we do start thinking other pathologies medically that we want to rule out. But yeah, ruling out these scary things, whether it's a device feedback, of course it's not that, but whether it is a brain tumor or other medical pathologies, we want to rule that out. But man, training people and their perception of this threat, that does take some time if they have been dealing with it for a while. And it is a shame, like you said, one of the best opportunities that we have across all of medicine is this black box that is tinnitus is not something you just have to live with. Would we tell people if they came in saying that I'm stressed out, we're all stressed, just live with it? I mean, you would say that if you're in a bad place or if you didn't understand what you were talking about, but there are so many solutions. It's not a pill. It's not here, take this and you'll be good next week. Unfortunately, it's not that, but also fortunately, it's not that because if you can manage your tinnitus, particularly if it's bothersome, and you can take it down several notches on that respective pain scale, if you will, that severity scale, you can do anything. You can change your body in relation to any other stress in your life because it really is just a signal from your brain or a stressor that's coming from the inside. And the tools that we can use to manage stress, we can use to manage tinnitus.
Well, I think that, this whole human kind of perspective is really important because when you take a look at and I've been diving a lot into the research throughout the years and trying to understand how do you simplify this for patients and help them understand that there's more within their control than outside of their control when it comes to tinnitus. And it does roll into every other health related issue that we face as well. But the way that we counsel patients is, once we get through all the nasty medical stuff and we know that they don't have a brain tumor because that's the first thing that most people will be concerned about, or some strange neurological disorder, which again, super rare. But once we get kind of beyond that, we could say with a very high level of certainty, look, this is a normal symptom of changes that have happened to your hearing system. Now, in certain cases, it could be TMJ related, it could be cervical spine, there could be muscle related stuff. Yes, that does exist. We don't want to completely, but let's put that aside for a second. Once we get through all the nasty medical stuff, we start to talk about the things that impact tinnitus in either a positive or a negative way. First thing I always talk about is sleep. Sleep is the linchpin for tinnitus. Without a doubt, either someone with tinnitus is having difficulty getting to sleep, or if someone has bad sleep health, whether they're not getting enough quantity, quality, consistency of their sleep, they're getting out of bed and their body's physiologically stressed the next day, which will fuel their tinnitus perception. That could be within their control, right? So like, oh yeah, I haven't been sleeping very well. So that's one thing. Exercise, movement, especially movement outside. It is so critical for patients to move because we know that all the research shows us that even just moderate degrees of walking outside every day is going to positively impact your symptom of tinnitus. You're out of your head and into your environment, right? So sleep, exercise, neither one costs a penny for those patients. And then we talk about the psychology piece, stress reduction, mindfulness based strategies, resilience, whatever it might be that we're in cognitive behavioral therapy, all in the psychology arm of that. All of those things are within the patient's control and it's going to help their quality of life overall. So why not start with the low hanging fruit before they start getting into all the other crazy pills and all that stuff, right? We don't even talk technology with patients until after we talk those elements of the kind of those other legs of this of the table. So important that we say, here's the points of empowerment for you. How much of this are you actually doing right now? The challenge with that, Kyle, is that most people don't want to take responsibility and do those things because they're, and I hate to say this, but a lot of us are lazy, right? We don't get enough exercise. We think that looking at our screens in bed before we go to sleep is a good way to fall asleep, which is the worst thing that we can do, right? They don't take care of their mental health, especially with coming out of COVID and all the stressors in the world. I don't care what side of the political spectrum you're on. Everybody's experiencing stress at this point, right? So dealing with those things first, so critical for those patients, for us in general, but definitely for tinnitus patients.
Yeah, it's funny. I'll give safety stand downs on either hearing loss prevention related things for my job as an audiologist, but a lot of stress management and resilience things. But when I give some of my resilience and stress management ones, I talk about my role as an audiologist in the military and that I deal with the number one injury every year for sure, which is noise induced damage.
Mhm.
And that affects about 10% of the military every year. We've gotten better over time, but we're kind of right around 10%. There are opportunities, but it's just a hazard that's prevalent. It's dynamic. It's always changing, and there's a lot of exposure. So opportunity, but 10% prevalence, which is high. Like you said, 15% prevalence for bothersome tinnitus around the world. That's enormous, huge numbers. And then I ask the room, who's impacted by stress? Of course, everybody puts their hands up. Stress affects all, and we're going to have times where it definitely impacts you. But there are a lot of things that you can do, not only to manage it once on your plate, but when you're in a pretty good place to prepare for it. Next time it inevitably comes, so you can train the skill that is resilience. And I like to think about tinnitus in the same way. That there is going to be modulation of when it is more bothersome, when it is not, whether it's when you go to bed at night, during the day, around stressful environments or not. Everybody is different, which is why one of my favorite parts of our field, we have all of these cool diagnostic tools, all these cool devices. I mean, I spend 75% of most of my consultations. I'm in primarily research and consultation right now in the military. But when I do see patients, 75% of that is just talking to them, case history, learning more about them to see their unique opportunities for whatever the issues are that brought them in that day. And there's so much cool research that, like, depending on the field, about 75% of pathologies can be accurately diagnosed by an expert just with a thorough case history. But when you understand those opportunities, some of the best psychologists and psychiatrists that I've worked with in the military said the exact same thing that you did before a psychologist refers to a psychiatrist, or a psychiatrist prescribes medication, they will do their damnedest to see if they can dial in what inevitably is going to be impacted by mental health disorders: sleep, nutrition, and movement. Because if you can get yourself to start focusing on those areas, we know that that does just as well as most of the medications that are FDA approved out there. It is a heavier lift for sure. It requires a lot of buy-in and adherence, and that is harder to do. It takes more time. Pills are obviously easier, but the ones that are really dedicated to seeing what they can do to help their respective populations, we try to put some ownership on the person because that is sustainment. That pill, by the way, there's places for pills for a lot of these pathologies, for
Sure, no
sure.
doubt.
Most extreme cases, absolutely. But with tinnitus, there is no pill. Even if there was one, I don't know how beneficial it would be for this because of the brain phenomena that it is. So
Yeah.
that brings us to what you're doing now. We talk about your career, your evolution, all these cool things that you've been involved with our ways to manage tinnitus. You recently co-founded Modern Tinnitus, where you're working with Dr. Cliff Olson.
Yeah.
Tell me about what you guys are doing, and how you've used kind of modern technologies and capabilities to evolve what we can do with tinnitus even more.
So modern tinnitus kind of stemmed from my background with diabetes. So ironically, and I'll give a little bit of a backstory, and then you'll understand why this matters. And there's such parallels between management of blood sugars and management of tinnitus. And I saw these parallels for years. I just didn't understand how to kind of get them to crosstalk. And about maybe 3 or 4 years ago, I started to understand how to get them to crosstalk. So I had a sudden hearing loss when I was at Columbia as a CFY years ago. Standard treatment is dexamethasone. The hearing came back, but what happened was the steroid ended up kind of damaging my pancreas to the point where I didn't produce enough insulin. At the time, now this is going back 26 years ago or so, the best we had was a finger stick. So, if someone's diabetic in your family, they poke a hole in their finger, they take the blood, puts it on what's called a glucometer, gives them the number, they see if it's within range, and they make decisions based on that number. That was the best that we had years ago. But the problem was I didn't have the ability to make really good decisions about, how exercise impacted my blood sugars or food or poor sleep or stress or alcohol or any of these other variables that were out there because I was only getting a point in time. It was just one point throughout the course of time. So I was missing a lot of the fluctuations that were occurring until fast forward about a decade or so later, continuous glucose monitors came on the scene, which provide us through a sensor with blood sugar readings every 5 minutes. And I can actually see trends that emerge. Now, the reason why that is so important is because it empowered me and it empowers millions of other diabetics around the world to understand what poor sleep, stress, foods, etc., do to our blood sugars so we can make better and more educated decisions about our own care in real time. Really, really important. Now, when you take a look at tinnitus, the best that we have for tinnitus are subjective questionnaires. The tinnitus handicap inventory, tinnitus reaction questionnaire, there's a number of them standardized. They're wonderful. But what they do is they give us an understanding. The patient answers these questions, and it gives us an understanding of how tinnitus is impacting a person's quality of life at that point in time, similar to the finger stick. But we don't know what's happening all around that point in time. They could be better and less bothered by tinnitus 5 minutes before, or they can be in a really bad place 10 minutes later, but we don't know. Best that we have is subjective questionnaires. What I started to look at were proxies for tinnitus perception and what might impact tinnitus in a positive or a negative way. We just talked about sleep, we talked about movement, we talked about stress levels. So what I started to look at a few years ago were patients' Fitbit data, their Whoop band information, their Aura Ring data, which gave me an understanding of what was happening with their sleep, what was happening with their stress levels, specifically through heart rate variability, which is a direct metric of how we're dealing with stress, and what was happening with their movement. Because we know when we take a look at all the research, all of those different metrics are intimately tied with tinnitus perception. So they're not measuring tinnitus necessarily, but they are measuring the things that are directly impacting tinnitus that or equally as important, a patient has direct control over. So we're able to give patients control over things that will ultimately impact their tinnitus one way or the other. So we started measuring this a few years ago, but then we started to develop our own proprietary platform for tinnitus, where we look at sleep metrics, heart rate variability, and movement metrics to start. And we have been using that as the continuous glucose monitor for our tinnitus patients to help them help clinicians make more educated decisions for those tinnitus patients. But equally as important is empowering those tinnitus patients with data and information so they can help to treat themselves better, essentially, as they go forward. So it's a wonderful tool. It's called Basecamp. Modern Tinnitus is the company that we started. And at this point, we've got about 20 modern tinnitus specialty centers around the country. These are independent clinicians who are tinnitus clinicians uh, who are just interested in doing tinnitus work at the highest level possible. Our ultimate goal with this is the data that we'll be able to get from all of these patients. And it's anonymous. We don't have access to patient information. It's all HIPAA compliant. But the information we get will ultimately help all of us as tinnitus clinicians make better decisions because the data, once we crunch it all, will be able to really give us some interesting patterns and hopefully correlations where we'll be able to counsel patients to get to the endpoint faster. So it's been a really, really interesting and fun project. And it's kind of parallel to so many things that are so important to me. And it's like integral to so many things that are important to me. And I love talking whole health with my patients and whole health with our colleagues in our field because it's opening up. And I truly believe this is going to be a standard of care as we go forward because it's treating tinnitus in a way that no one's ever treated it before. And it matters. It really matters. We're seeing such interesting data, which we can talk about, that has come from very large studies outside of our company that just kind of prove our model. So we're really excited about it, though.
I love everything about it. You're measuring what matters in these recommendations that we've been making, but now it can be a collective discussion on this is where you are. You're empowering the person to consider what they're doing, what they're not doing, and here are opportunities to. I mean, you're teaching people how to manage stress. Like really, like this could be
Everything.
used. This could be used in the same way I talked about with those psychologists and psychiatrists that are not willing to prescribe medications until we give a good try at some of these other controllable environmental factors to improve your quality of life through
Yeah.
sleep, nutrition, and movement. It's just such a beautiful concept because the power of biometrics, as we're seeing across the world, is such a great way for people to kind of gamify some of these things that you have a high performer who's already dialed in. They know sleep's important. They know um, they're already trying to prioritize movement and maybe think about their diet in a disciplined way. Now, they may require a different type of management if they are experiencing tinnitus, but for the majority of cases, some of those buckets, there are going to be opportunities there. And even with your biometrics, you can still see based on what they come back and tell you with patients, this is what I'm noticing. Then you can look at the data and unique conclusions for each individual. I'd love to hear what you just alluded to, that there's a lot of great data out there already, not only from you, but other companies that are just proving your model. What are some of those data?
Yeah. So, what the most interesting and the largest scale study that was just released not too long ago is Apple Health study that was done in conjunction with the University of Michigan. And they had 73,000 participants that were wearing Apple Watches that had tinnitus. And what they were able to definitively show is that heart rate variability was directly correlated with tinnitus perception. So, for the people who are listening who are not familiar with heart rate variability, it's a direct metric of what's called our autonomic nervous system. Basically, the delicate balance between our rest, digest, and relax side of the nervous system and our stress, fight, or flight nervous system. And that controls literally the distance between our heartbeats. The more variable our heartbeats are, the more in the better we're able to deal with stress, essentially. So the higher the heart rate variability number, the better our systems are able to deal with stress. The lower the heart rate variability number, meaning that those heartbeats are pretty consistent, that means that our system's under stress and we're not dealing with stress very well. So what they were able to show is that there's a direct correlation between heart rate variability, meaning the autonomic nervous system, and the perception of tinnitus, if they perceive it as louder or less bothersome. 73,000 participants. Now, we don't have 73,000 people that are on our system right now yet, but what I can tell you is that anecdotally, I can share case study after case study where, as you were talking about this individualized care, which is so critical, where a gentleman came through, he was going through tinnitus treatment, he was doing wonderfully. He was bothered by tinnitus for almost 30 years, took him through linear neuromod, this newer treatment. He did great. And then he came back about 6 months later and he had a really bad stretch of time with his tinnitus. I said, "What's going on?" His dog suddenly passed away. Dog was his closest friend. I looked at his biometric data and you saw the day that his dog was put to sleep, his heart rate variability completely crashed out on him under a lot of physiological and psychological stress. So I was able to say to him, it's clear your system is still under stress. You have to understand that when your system's under stress, you're likely going to be more bothered by your tinnitus. Now, what we need to do is double down on healthy stress reduction techniques and habits, whether it be breath work, yoga, running, whatever works for you, better sleep, taking care of yourself. And just what he did. And then you saw the heart rate variability over time start to come up, just like the blood sugars, right? So, a wonderful, wonderful proxy for what we're seeing from a tinnitus perspective. Same thing we see with sleep. Uh, we would see patients who everybody says their sleep is fine until we measure it. Um, I had patients pre-treatment, we would look at their sleep data and they were getting maybe 6 hours, 5 hours, 3 hours, 7 hours, very inconsistent sleep, very small percentages of deep and REM stage, which are so critical for physical and brain restoration, right? Those are the dream state and the physical restoration state. Then we would take them through treatment and they would say, I'm actually dreaming more vividly. It's like, oh, interesting. You take a look at their sleep metrics, their sleep consistency is more consistent. They're getting to sleep and wake cycles each night more consistent. More quantity of sleep, 7+ hours of sleep. But most importantly, their deep and REM percentage is significantly improved. Their systems are just being able to recover faster when they can get that kind of sleep. So all of these things we're measuring now. And again, if we can fix those things, we can definitely impact tinnitus in a positive way because those things are directly and intimately related with their tinnitus. So we have lots of stories like that.
I just, I love everything about this because you're helping reduce tinnitus severity by helping people become
Yeah.
healthier, helping them manage stress. Like you're changing lives through the lens of tinnitus, using modern technology, which you very wisely named your company, Modern Tinnitus. It's just such a cool thing. And coming back to your definition of tinnitus, and again, the first time I heard the internal auditory amplifiers, it makes so much sense what we're seeing with the data now because when we are more sympathetic, when we are more stressed, our entire brain is more activated. We have the limbic system, our emotional brain, kind of overriding the other areas of the brain while we're experiencing that stress response. And of course, modern days, I mean, sometimes very naturally, grieving after the loss of a loved one, whether it be a pet, spouse, friend, you name it, that's natural. You're gonna be stressed. That's a very natural response, but that's gonna still do the same thing, have you be sympathetic, amplify everything, including those auditory amplifiers, and bringing up something that you had maybe better management of. It's just very natural the brain is going to respond the way that it will. Or rumination technology and everything else these days that has these dopamine spikes that makes us more agitated because of the access that we have to things that can make us outraged or outrageous right now. Um, yeah, it's going to also contribute to the sympathetic nervous system and the internal amplifiers that could be tinnitus, stress, or anything else. So what you guys are doing with modern tinnitus is it's not only decreasing tinnitus severity, it's decreasing stress, and that's what
Yeah.
it resonates with me so much because you know my little side mission outside of what I do in the military with stress management resilience, and you're doing exactly that through the lens of tinnitus, and it's beautiful.
Yeah, that's been my evil plan, for a while. It's ever since I think I've always been a resilient human growing up. I've had no choice. I was a product of the '70s and '80s, and we had no choice but, like, you fall off your bike and you hurt yourself. You gotta figure it out because 'cause you're out in the middle of nowhere with no phones, right? Um, but the whole experience with diabetes in particular has forced me to actually, uh become and kind of look for tools, strategies that help me become a more resilient human. And what I feel, and this has it's indirectly related to tinnitus, as you're saying, but it's it's kind of been a mission of mine to help others become more resilient, whether that's through breath work, right? So I trained in breath work, and one of the most and I don't tell my tinnitus patients to do this because it's a very physiologically stressing type of breath work. But I'm a big fan of hypoxic breathing, where see how long you can hold your breath for, right? And you will literally never starve yourself of oxygen. It's like you can go so much longer, but that's building resilience, right? It's like I can get through this. The types of training that you do, the races that I've run, the stupid bikes that I used to ride, for miles and miles and miles just to push through the pain. All those things are so critical for me because um, I think that our as a society, and I don't want to get on a soapbox here necessarily, it's this like kind of like I forgot who said the quote, but I'll paraphrase. It's like easy times breed soft people, soft times breed hard times breed tough people, right? It's like that cycle.
Yeah.
I kind of feel we're in one of those like soft people time. And the world needs a lot more of what you're doing. And on a smaller level, the stuff that we're doing with our tinnitus patients, because we're just helping them become more resilient humans. And you're right, it's just through the window and through the lens of their tinnitus. So yeah, there's an evil plan there, in many ways, but I think we're doing good work.
Well, I'm all in, and it can definitely appear these days that we're going through one of those soft times, and we very well may be. But I think we have such a distorted lens through where we view the world, whether it's social media or the news. We always see the worst. We always see these stereotypes and these generalizations and these trends. But then when you get out and you talk to people, especially like the Gen Zs and the younger individuals, I'm not experiencing those snowflakes that we're talking about, and even millennials. I'm an old millennial. when you get out and you talk to a lot of people, most people are doing a lot better than what we make it out to seem through social media, where even half the time there might not even be people, there might be bots. That being said, there's always an opportunity to be more resilient, to train that skill, to manage inevitable stress. And it's worth noting, by the way, if we don't have enough alike already, which is why Gail introduced us, you had a podcast for 4 years where after you were diagnosed with type 1 diabetes and you were managing that, you decided to seek out other individuals, not only with type 1, but just amazing individuals who overcome adversity to go on to thrive in their respective domains. And that's tied into this incredible website that you built. And it's so cool to see the overlap that we have, not only in the interest that we have in our scope of practice, but outside of it, and what stress management and resilience can do, not only for these medical pathologies that we may have to endure, but really just for life in general. So, brother, I appreciate you, what you're doing for our field. Thank God you're one of the ones that represent us because you do it quite well. I'm definitely going to be linking your website. Not only for modern tinnitus, what you're doing with the New York hearing doctors, and then of course that website from back in the day, which I can't wait to dive deeper into some of those podcasts, including whoever that Cavalier was, the basketball player. We'll figure it out after the fact. But man, I appreciate you. This was fantastic, and keep executing that evil plan because you're going to be doing some amazing things, you and Cliff.
Oh, I appreciate that. It's definitely been an honor. I feel like I've known you for a really long time, even though we've kind of only kind of crossed paths in recent year. And I thank Gail Whitelaw for actually making that introduction because I've learned a lot from you in a very short period of time, and I know I will continue to learn a lot from you. And your audience is lucky because they've got someone at the helm who's kind of driving this ship of resilience and kind of mindset that we desperately. I think I want to. I didn't want to say that everybody's a snowflake. That's not what I meant before.
I
So
know, I know you.
because I've got two young men that are my offspring that are definitely not snowflakes. Um, but you're doing great work also, and it's really a privilege to have this conversation. And look, we're going to continue to talk online and offline, and I really appreciate the opportunity just to voice what we're doing.
100%, brother. Thank you again. We'll talk soon.
Awesome. Take
All
care,
right,
man.
you too.